Today we're gonna start with the critical care. First, we're gonna start with cardiovascular, and in the cardiovascular we're gonna start with the first one. This cardiovascular, pregnant lady with hypotension. First, I'm gonna give you general rules here. When you study this material, always ask yourself questions because this is the format of the exam. You will be asked questions and you need to answer. When you study the material from A to Z, come back and practice it in the exam mode, which is question and answer. General principles and tricks for the knowledge. First, be confident. Practice same way as the exam. Put the timer for 9 minutes and practice the station same way. If you don't know the answer, ask politely your examiner, can we skip this question and come back to it later? Don't say I don't know the answer, because if you said I don't know the answer, the question will be cancelled and it will be marked for this question and you cannot get back to it. So say, can we get back to this question later on, please? If you didn't know an answer for a question, don't panic. Try to make yourself calm and continue with the station. Missing 1 or 2 or 3 questions doesn't mean you're gonna fail the station. The possible scenario, this is not the scenario that you're gonna have on the exam, but we're just gonna give you an idea. You will be outside and this will be written in a paper. A 34-week pregnant patient undergoing open cholecystectomy for necrotizing cholecystitis experiences decreasing blood pressure and heart rate in a reverse Trendelenburg position under combined general anesthesia and epidural. Benefit and risk of surgery during her pregnancy. So you have two contradictory conditions. You have necrotizing cholecystitis and you have a pregnant lady. Benefits: control infection, potentially preventing sepsis, and induction of preterm labor. So you are trying to control the infection, prevent the sepsis, and prevent the induction of preterm labor. So basically you're preventing the preterm labor. Risks: preterm labor, intrauterine fetal death, deep vein thrombosis due to prolonged surgery duration because she's a pregnant lady. Care team involvement, and the question probably will be, who will you involve in the care of this lady? Neonatologist, obstetrician, ITU registrar, and anesthetist. Post-operative management, specifically the location of the post-operative management, she will be managed in the obstetric high dependency unit, HDU. Understanding of the hypotension causes. Why this lady has hypotension? Due to compression of the IVC, inferior vena cava, by the uterus, which will decrease the venous return and cardiac output. Reverse Trendelenburg position and potential sepsis from necrotizing cholecystitis. So you have 3 main reasons for the hypotension: compression of the IVC, reverse Trendelenburg position, and possible sepsis from necrotizing cholecystitis. And as you can see here, the baby is pressing over the inferior vena cava, which will reduce the blood to the heart, reducing the preload. Simple measure to increase the blood pressure: repositioning to the lateral to alleviate the IVC compression. When the lady lay on the lateral side, the baby will not be pressing on the inferior vena cava, as you can see here. Raising the patient's leg to increase venous return and preload. Preload and shock overview. What is a preload? Preload is the volume of the blood in the ventricle at the end of diastole. What is shock? Shock is circulatory failure leading to inadequate organ perfusion and unmet metabolic demands. These are important definitions. Body response to decreased blood pressure. Baroreceptors. As you can see here, imposed decrease in arterial blood pressure will lead to activation of baroreceptor, sensed by arterial baroreceptor as decreased stretch. This will lead to decreased baroreceptor afferent nerve activity, which will lead to Signal processed by the medullary cardiovascular control pathway. This will lead to increased heart rate, increased force of the heart contraction, and arterial vasoconstriction. This will also decrease the parasympathetic activity, which will lead to increase the heart rate. As you know, parasympathetic is rest and digest, so it will decrease the heart rate. When you decrease the activity of parasympathetic, this will increase the heart rate. The overall response will increase arterial blood pressure. First, we talked about the baroreceptors. Second factor is hormones. Catecholamines and mineralocorticoids like cortisol stimulate peripheral vasoconstriction and salt water retention. Salt water due to aldosterone, right? Aldosterone brings sodium in and disposes potassium. Physiological response to standing. When you stand, you will decrease the venous return and cardiac output, temporarily reduce blood pressure, countered by reflex vasoconstriction and tachycardia to normalize pressure. Baroreceptor function, they sense the arterial wall tension changes, which will lead to regulating the blood pressure. Factor affecting venous return, you have to memorize this. You may be asked about them. Muscle contraction, respiratory activity, decreased venous compliance, and gravitational effect, like gravity. Mechanical DVT prophylaxis device. First one is intermittent pneumatic compression device. As you can see, this is one of them. Okay? And the other one is thromboembolic deterrent stocking TEDs to improve circulation. This is one of the TEDs. Improving preload. How you can improve preload? By administration of fluid, inotropic and vasoreceptor agents. Actions of inotrope, adrenergic agonist, elevate myocardial contractile force and systemic vascular resistance SVR, augmenting arterial blood pressure and enhancing organ perfusion. Dopaminergic agent in specific dosage induce vasodilation, reducing SVR, potentially optimizing cardiac output while minimizing myocardial oxygen demand. And this will conclude our first station, pregnant lady with hypotension.